thank you for being here today to participate in WAP's third Preparing for Parenthood workshop. Firstly, huge congratulations at this exciting time of your lives. As a mother of three, I fully empathize with the excitement, but also with the daunting nature of this time as near-due parents. Moreover, in these unprecedented times, there will be even more questions and concerns, which we know our fantastic experts presenting today will answer and support you with. Our two previous Preparing for Parenthood workshops were face-to-face days at Northwest Jamatkana in London. During this time of lockdown, however, we are delighted that so many of you can now connect with us online, giving us greater exposure to support our Jamaat. The net allowing us to welcome participants from Coventry, the US, and Pakistan, I believe, today. So everybody, a huge welcome. Without further delay, this moves me swiftly on to present WAP's National Council member, Shalina Huda, to say a few words. Shalina, over to you.
Thank you, Shayla. Yalandid, everyone. And again, on behalf of the Women's Activities Portfolio, Aga Khan Education Board and the Health Board, congratulations on beginning or continuing your journey through parenthood. The Women's Activity Portfolio is focused on supporting women throughout their journey in life to uplift, empower, and support them through their life challenges, support you as you grow your families. So this session recognises the needs of women in one of those initial phases in growing your family. Preparing for Parenthood is normally a face-to-face event, and we usually hold it for a whole day. Because of the current circumstance, we've had to adapt it into a webinar and focusing more on the COVID environment. So we will eventually have multiple sessions breaking down into different topics as you continue your journey through parenting. Pregnancy is an interesting time for women and those around pregnant women. So many emotions and so many thoughts. You'll be feeling very excited to be welcoming a newborn into your family. You might be feeling happy. You might be feeling a lot of love. You might be excited to be growing your family. You might be feeling sad that right now you can't be with your wider extended family or other friends that are close to you. You might be feeling worried about the current situation. You'll probably be feeling very tired. And I think being at home is also affecting our tiredness levels as well. So whatever you're feeling, we are here to support you. We will do our best to answer your question today and help you feel better informed and give you some comfort. So I will now hand over to the rest of my team to get the session started.
Thank you so much, Shalina. On screen, you will see the agenda for the workshop. Just a couple of minutes to digest what's on the agenda. As you can see, we've got a lot of information to impart with you today. At this juncture, we'd like you to take a minute to complete the pre-session evaluation on menti.com. Please log in now and use a code that's been provided. This allows us to give a sense of how you're feeling right now, just taking on board the introduction that Shalina made of the various emotions that you might be feeling. We'll give you just 3 minutes to do that now, please. Terrific. Thank you, everybody, for completing that. Hopefully that's given us a sense of how we're all feeling right now. So we'd now like you to be introduced to our first speaker, Dr. Shehnaz Jivraj, consultant, obstetrician and gynecologist, who will focus on mitigating risk in light of what we know. Over to you, Dr. Shehnaz.
The Chief Medical Officer deemed pregnancy to be a high-risk state, which meant that he grouped pregnancy with those individuals falling in those groups that were considered to be particularly at risk of severe coronavirus infection. Now, he did that for pregnancy not because when you're pregnant, you're more likely to catch coronavirus. You're not. You're not more likely to catch the virus in pregnancy any more than you are outside of pregnancy. However, what pregnancy does, it does induce some immunological changes in the body, which makes some pregnant women particularly vulnerable to severe COVID-19 infection if they got infected with the coronavirus. And so, to take a precautionary measure, all pregnant women were grouped as high-risk individuals. What this meant for pregnant women was that extra stringent social distancing measures were to be undertaken. And among these measures was working from home. Now, clearly, there will be some pregnant women who won't be able to work from home because they work as key workers or they work in the essential services. For these women, the Royal College of Obs and Gynae published some guidelines, and they drew a demarcation at 28 weeks of gestation. And 28 weeks of gestation was chosen because that demarcates the second trimester from the third trimester. So 28 weeks is the beginning of the third trimester. And what we know about pregnancy and infection is that in individuals who are prone to infection, this happens to be a greater risk in the third trimester or in the latter parts of pregnancy, as it is with COVID-19. So what these guidelines state is that if you are under 28 weeks of gestation, working in a public-facing role, which means you may be working in a hospital, you may be working in a supermarket, anywhere where you have to engage with the public, that's fine to do so, provided you are generally fit and well, you have no coexisting morbidities, such as you've got no existing medical conditions such as diabetes or severe asthma or raised blood pressure, that you're happy to do work in a public-facing role, and that your employer provides you with adequate personal protective equipment. After 28 weeks, it's advisable to stay at home and only attend for antenatal clinic appointments. Which brings me on to antenatal clinic appointments. Just day before yesterday, the Royal College of Obs and Gynae updated their version of guidelines that they have published for healthcare workers to guide them in how they look after pregnant women. This is now version number 7. There is ongoing education in this field. There's a lot of coronavirus and exposure to pregnancy that we don't know about, a lot that we are learning from other countries, and a lot that we are continuing to accrue experience for. In the most recent version of the guideline, they've urged all healthcare professionals to encourage women to attend for antenatal clinic appointments if they are invited to do so. Now, it is very likely that your antenatal clinic appointments will be modified. They'll be modified to reduce unnecessary exposure to the pregnant women by attending hospital. They'll be modified to reduce the clinics to telephone consultations or video conferencing. But a balance will have been made to balance risks versus benefits. And if you are invited to attend for a face-to-face consultation, then it is advisable to attend, provided you're not self-isolating. If you are self-isolating, then you're urged to contact your maternity team, be it the hospital or your midwife, and let them know so that your appointment can be deferred to a later stage. If you happen to have COVID-19 or are suspected to have COVID-19 when labor starts, telephone the labor unit, let them know. They will give you appropriate advice on how long to stay home, when to start making your way to hospital, and what mode of transport to use. And what you must be reassured about is that when you are in hospital, in labor, you will be given appropriate personal protective equipment to wear. You may have any form of analgesia that you like, be it diamorphine, be it Entonox or gas and air, or be it an epidural. The only form of analgesia that is not permitted is the use of a birthing pool. You will also be put on a CTG monitor to monitor the baby's heartbeat and heart rhythm, to pick up any early signs of fetal distress so that intervention can take place as soon as possible. And for a lot of women, the burning question often is, can I bring my partner with me? The answer to your question is, yes, you may. As things stand at the current time, you may bring your birthing partner with you, provided they are asymptomatic. It's always good, therefore, to have a substitute and bring them with you, provided they are asymptomatic. And they will be allowed to be with you through the birthing process until you've delivered. Then they will be asked to go home when you're transferred to the postnatal ward. This is to keep you safe, this is to keep your baby safe, and this is to keep other women safe. What happens next now, I will pass you on to my colleague, Dr. Farah Banji, who's a general practitioner who will speak to you about what happens to you and the baby in the postnatal period. Over to you, Farah.
Thank you, Dr. Jivraj. So yes, I'm really going to cover the medical aspects of postnatal care. So this is really the first 6 to 8 weeks after you've had a baby. And I already know that some of the participants, I think you have already had your babies, but congratulations to everyone who are expecting and who already have a little one at home. I'm also going to cover the indicators or the symptoms that you should look out for in your baby to possibly suggest that they are unwell, particularly acutely unwell, and those scenarios when you would have to seek emergency care. And actually, before I get into those topics, I do want to just stress two things. And the first one is really, even in the light of coronavirus outbreak, essential postnatal care in the community is still going on. So I don't want any of you to feel that you'll be on your own once you are at home with the baby, and you will always be able to seek professional support. And secondly, it's really to say that I know, and understandably, we're all worried about coronavirus, but actually other illnesses can occur, particularly in the postnatal period, such as other infections that might affect mother or baby, jaundice, feeding problems, etc. So I guess I'm urging parents to really seek medical help and not to be anxious about exposing themselves to coronavirus if they're asked to attend for medical appointments. And really just to reiterate what Dr. Jivraj has said, that if you are going to be asked to attend a medical appointment, that will be because the health professional feels that it's necessary. And certainly if we don't feel it's necessary, your appointment would be amended to a telephone or a video call. So I'd like to just stress that don't delay seeking help if you have any particular concerns. And then again, about coronavirus itself, and again, the advice says that in the postnatal period, there is no current evidence to suggest that mum or baby are at increased risk of contracting coronavirus. And to date, actually, the babies that have been infected with coronavirus, actually, in general, their symptoms have been quite mild. So again, we know that there's this concern, but it's to not to feel too anxious about things and to seek help. I think that I'd just like to stress what Dr. Jivraj has said about sticking to government advice about social distancing. It's important, particularly when you're at home with your baby, to adhere to that advice, strict hand washing, avoiding large gatherings, and use your and I suppose don't feel worried or that you're putting a burden on friends and families to seek their support in other ways. So yes, they might not be able to come and visit so often, but you could ask them to help with meals that they can deliver to the doorstep if you have people nearby. So get the support that you need from friends and family, and I'm sure that if they're able to, they'd be most willing to help. So you've had your baby and you're heading home from the hospital. So what next? So your baby will be checked by a paediatric doctor at the hospital. So the physical checks will be done before discharge. And you'll be given lots of information about local support services, for instance, breastfeeding clinics. In the UK, every baby has a named health visitor, so you will be given their direct contact details. And they will certainly be in touch with you and arrange reviews as appropriate. So at the moment, if there are no concerns, most reviews are occurring over the telephone. But if there are any concerns, either because it's been a complicated delivery, or as a parent you have concerns, or if you've had twin birth, multiple births, or if you've had a baby who is premature, then you will certainly have more regular reviews, and they may involve attending medical appointments at a clinic. Then around 6 to 8 weeks after delivery, you would be having medical checks. So that would be for mother as well as for baby. Usually these checks are done face-to-face, but again, this process has been modified in the light of coronavirus. So you may find that a lot of these checks occur over the phone, and any examination may then be postponed. But for mum, the maternal check that occurs, as I say, around 6 to 8 weeks after delivery will include questioning about just your general health and well-being. You will be screened for symptoms of anxiety and depression, and certainly this will be covered in much greater detail later on in the webinar. There will be a discussion about contraception if that's appropriate, because women do need to use contraceptives from 21 days after delivery. And again, the services available have been slightly modified. So birth control pills are still widely accessible, but other contraceptives such as a coil fitting, these are more than likely they will be postponed. And then the doctor will discuss with you about cervical smear tests. So these are the tests for screening for cancer of the cervix. And if mum was due a check whilst she was pregnant, the normal practice has been to postpone that to 3 months after you've had a baby. However, in light of coronavirus, this may be postponed for a further few months, which should not really have any, should not cause any clinical harm. But certainly if you've ever had these tests and have had abnormal results, then do discuss that with the doctor, particularly if you are due a smear test, because provisions are available for you to attend to have these checks done if a doctor feels that it really cannot be postponed until it is safer to come into, for instance, a community clinic or a doctor's surgery after the worst of the outbreak is over. And then for baby, the checks that generally occur around 6 to 8 weeks include a general check, again, of their physical well-being, to check that they're feeding all right and that their weight is okay. And if there are no concerns, this will generally be a telephone assessment. But if there are concerns about weight, or if a doctor feels that your baby's heart or hips need to be checked, then again, provisions will be made for you to bring your baby to a clinic, and it will be a safe environment. So for instance, in my local surgery, if we are asking for parents to bring their babies for any medical checks, you certainly will not be waiting together with other patients in a waiting room. At the moment, we're using the car park actually as the waiting room because you're safest in your car, and a healthcare professional will call you and bring you into the building if you need the checks. All healthcare professionals are wearing, even in the community, they're wearing personal protective equipment to include gloves, masks, eyewear, and the parent may also be asked to put on a mask. So don't be perturbed about that at all. It's really just for everyone's safety. But one thing I would like to stress is that we definitely do want to see babies for their childhood immunizations. So as I say, that clinics are still going on for that. Provisions are all in place to keep us all safe. And it is really important that you do bring your baby for these vaccinations. And they're against infectious diseases such as whooping cough and measles, which potentially could actually cause more complications to your baby than coronavirus. So it's really important that you attend for those. I'd like to move on to just speaking briefly about symptoms of an unwell baby, but actually the specific details will be given to you in the form of handouts, which will be sent to you after the webinar. And it will be better then for you to be able to read through those in your own time. But in general, the take-home message is that actually, if you as parents have any concerns about your baby, then speak to someone. Speak to a healthcare professional. And in the UK, your first port of call would be your health visitor. It would be your GP surgery, so they're open and taking phone calls. And it would be 111 if the surgery or health visiting team are closed. With regards to emergencies, so we call this sort of any red flag symptoms that you might detect in a baby. And they really cover 3 areas. So that's breathing problems, colour, and movement. So in a baby, breathing problems would be if a baby was struggling to breathe, they had an irregular breathing pattern. Colour would be if you noticed blue lips, if they looked particularly pale, had mottled skin. And movement would include, obviously, if a baby was fitting, if a baby seemed more floppy than usual, or if you were finding it very difficult to wake your baby, then in these instances, you must dial 999. In other countries, I know we've got some participants who are outside the UK, it's whatever your emergency number is. And one practical tip that you can do in preparation, I'm hoping you would never need to do this, but it's always worthwhile just checking on your mobile phone the quickest way to actually dial 999. So whether you can do that on a locked screen, you can sometimes access the emergency number just from a locked screen, or whether you actually put it as the first number in your contacts. So you could put AAA for ambulance, and so it's a lot easier then to dial if you need to. And certainly, again, I hope none of you would ever have to do this, but we will include details about baby resuscitation. So if your baby ever stopped breathing or became unresponsive, then we've included details in the handouts about what to do with regards to baby resuscitation. What I would say is just remember that you can carry your baby and whilst you're resuscitating them, and actually in the it would be such an anxious moment if ever anyone had to do that. But just remember that, for instance, if you're living in a 2nd floor apartment, then take your baby in your arms, carry on resuscitating the baby, and walk down to the entrance so that you're as close to where the ambulance would park up. So just some practical sort of tip there. But as I say, hopefully you won't ever need to do that. And then there are amber symptoms, which you should all be aware of. So these are symptoms where we would expect you to speak to a doctor. So that would be your GP, or to speak to a health visitor or dial 111. And these symptoms would include any sort of feeding problems, if your baby had a fever over 38 degrees, if you felt that your baby was jaundiced, for instance. But as I say, all the specifics will be included on your handout. So I know I've given quite a lot of information, but I do want to end by saying that the postnatal period, I'll be lying if I don't say it's a challenge. It is difficult. We're usually dealing with sleep-deprived parents. It's getting used to a new routine. But what I do want you to remember is that it is a precious time. It's a time when you can really form a very close bond with your baby. So cherish that time. Be kind to yourself, particularly in the light of coronavirus and with the restrictions that we will have by means of not being able to see our loved ones as much as we would like. So be kind to yourself. Don't stress out if the house is a complete tip, and just enjoy this time. And obviously do seek medical advice if you have any concerns. That's the important thing to remember. Thank you.
Thank you so much, Dr. Banji and Dr. Jivraj. Plethora of very practical, very, very important information, very timely information considering the unprecedented time that we're all living through now. So once again, thank you very much to both our doctors. Now, for those of you with questions for either of our doctors today, we have allocated some time now for those to be answered while they're still fresh in your mind. We have had a couple come through on the chat already, but we'll take a few minutes to give you the chance to either raise your hand to ask your question by voice, or to log into Menti to ask your questions. Now, if you are on Menti and you want to ask multiple questions, please submit the question, then type the next one in the same box. Do not click next question. If you're not engaged with using Menti, don't worry, just go to the chat. We'll give you a few minutes just to get some questions going. And it would obviously be very helpful if you could direct your question to either Dr. Banji or Dr. Jivraj if it's relevant. A couple of questions that have come through. One question has come through on the chat. Please, can you mention the options of vitamin K on baby arrival now with COVID?
Would you like me to take this, Farah?
Thank you.
Yeah, so it should make no difference whatsoever. If you are to be given IM vitamin K, then that's your choice. Whether you have oral vitamin K or IM vitamin K, COVID-19 will make no difference.
Okay, thank you very much, Dr. Jivraj. Another question that's come through on the chat. What if I'm having a C-section?
So at the present time, and this does vary from hospital to hospital, if you're having an elective cesarean section and you're having the cesarean section under epidural or under spinal anesthetic, as most cesarean sections are, then your partner will be able to be with you, but will not be able to accompany you to the postnatal ward. He will be able to be with you at the time of the cesarean section, but not afterwards. If you are to have a general anesthetic, then normally all partners are asked to leave the operating theatre when a general anesthetic is given. And this is no different for the COVID-19 infection. A general anesthetic is considered an aerosol generating procedure, which means even the operating theatre staff will be undertaking extra precautionary measures when doing the cesarean section. So additional PPE with an additional, more specific face mask to prevent COVID infection will be worn by all theatre staff. They will keep the number of theatre staff within the operating theatre to a minimum. And certainly your partner won't be allowed to be in the operating theatre. In any case, you will be asleep, and the role of the partner there is to support you while you're awake. I hope that answers the question. Was there anything more specific regarding the cesarean section? If there is, please submit another question. I'll be happy to try and answer it.
Thank you very much, Dr. Shehnaz. Yes, for whoever wanted any more information on that, either it can be done now, or as we said, there will be opportunity post-event as well, or we do have another dedicated Q&A at the end of the workshop. The next question that's come through, currently 29 weeks and was due to go on maternity leave beginning of June. I am a nursery school teacher looking after babies and toddlers. What is the advice if schools reopen before I go on maternity leave? Should I resume working in that environment?
Okay, so the RCOG guidelines are very clear on this. Above 28 weeks gestation, you should not be in a public-facing role. Your employer should facilitate an alternative form of work for you, and preferably working from home. And what I would urge you to do is to be in contact with your head teacher so that you have an occupational health assessment done now before the schools open, so that you know where you stand. But I would urge you to get the ball rolling now, and I would also urge you to try and be at home if you possibly can.
Very important advice there. Thank you for that question. Next question. If you deliver in a birthing suite as a natural birth and have your own room, can your partner stay with you?
So the answer to this is, if you are asymptomatic, if you do not have suspected COVID-19 and you are well in yourself, then that should make no difference to how you're managed in labor. If you are under midwifery-led care and the plan is for you to have a vaginal birth in a midwifery birthing unit, then that should take place, provided you're asymptomatic. Your birthing partner will be able to be with you. Different hospitals have different rules, but largely it's encouraged that only one person attends, and that is for safeguarding purposes, to safeguard everyone else from catching unnecessarily an infection that could have been avoided. If, on the other hand, you have symptoms of infection, then you will not be permitted to deliver in a midwifery-led birthing area. You will be delivering in a consultant-led care area, and you will be having continuous CTG monitoring for signs of fetal distress.
Okay, this question leads on to this quite interestingly. What if I get the virus after my baby is born?
If you get the virus after your baby is born, exactly the same measures are to be undertaken. You stay at home and you isolate. You self-isolate, but you can keep your baby with you. Okay.
Thank you. There is one more final question, and I think if anybody wants to raise their hand, I'll have one final opportunity until, and then we'll just take this last question and then move on to the next part of the agenda. Final question, after 28 weeks, how many times should the baby be moving in a day?
There isn't a specific number of times a baby should move in a day. Each baby has its own pattern. A ballpark figure is, if you can count up to 10 movements a day, you're probably fine. But I would like to say this with caution. What you want to do is you want to observe a pattern of baby movements. If you feel that this baby has moved 10 times a day, but its normal movement frequency is 40 times, and it has slowed down in its movement, I would urge you, pick up the phone, ring your birthing unit, and if they invite you in for an assessment, attend. It's the pattern that is more important than the number. If in your heart you are worried, follow your gut instinct. Pick up the phone and tell them that your baby is not been moving as much as it usually is, and they will invite you to have a CTG done. Go and get the CTG done.
Thank you. Very, very important advice all round. Thank you for your questions. That's all we have time for right now, but be assured that we have documented all your questions and we will reply to them at the end of the event or after the event if they haven't been answered. Just to add at this juncture that Menti will stay open for questions during all the sessions from now on. So as we go through, do go to Menti at any time you want. Otherwise, once again, we will have an option to ask questions by voice or on the chat at the final Q&A after the next few sessions. So without further ado, I'd now like to thank both our doctors once again for very vital, practical and very important information shared with our participants. I would now like to introduce you to Jamila, our very own WAP team member, who conceptualized this whole Preparing for Parenthood workshop. She is a neonatal nursery nurse at UCLH and will now impart some extremely practical guidance. Over to you, Jamila.
Hi, thank you so much. Congratulations, everyone. This is just the most exciting time for you all. And what we're going to go through is the essential things you need to buy. Some of you may have bought everything already. Some of you, if you're not due till late September, October time, even August, don't worry too much because you have time. If you're due in the next few weeks and you think, okay, I haven't got everything I need, I would say to you, try order online. I've been using John Lewis lately for work, and it's great to order from there. You can pick up from Waitrose or they will deliver home. So don't panic if you don't have anything, you're still able to go shopping online. So the first few things that are really important, what you need is somewhere for baby to sleep, somehow for baby to feed, possibly 90% a car seat for when you leave hospital, and some clothes for baby to wear as well, and something for baby to keep warm with. So the first thing we're going to talk about is safe sleeping, which is a slide before. Yeah. So when we talk about safe sleeping, we use a charity called the Lullaby Trust. So we have given you links for the charity that you can scroll and have a look through as well. But the main thing that you need is somewhere for your baby to sleep. So you've got Moses baskets, you've got, like the picture shows here, the Chico Next to Me crib, you've got cots. You choose which one works for you. But the advice is baby should be in your room from 3 to 6 months, up until 3 to 6 months of age. And then it's a good idea for them to transit into their own room, but it's up to you. But they do say to prevent, one of the things to prevent cot death is to keep baby in your room up until 6 months of age. But I have known people transfer their babies into a separate room when they're 3 to 4 months older. So it's okay. It's up to you what you decide to use. But one thing I've learned recently from other mothers that I have worked with is the crib that you're going to use that's next to your bed. Measure the height of your bed, measure the height of your crib, and see how high it is and does it kind of match up. If what you don't want is to be looking down and peering down on your baby all the time, it can hurt your back. So even if you don't have something at home at the moment, online they will give you the height requirements of cribs. So have a look, and then that will hopefully give you a better idea of what to buy. Another thing I want to stress is you don't have to always buy something new. If you are given something secondhand, that's great. I would use something secondhand, and it just saves you money, a lot of money. But the most important thing that you do have to buy new is your mattress. It must be waterproof, and it must be brand new mattress. Each mattress changes from baby to baby, so it is really important that you do get a new mattress. The reason we say waterproof is that it can get moldy, especially if your baby wets themselves or vomits. So if the mattress isn't waterproof, you can buy a waterproof cover. Another thing that I would always say is no cot bumpers in the crib and no toys in the crib, because they can fall over and go onto your baby's head. They say the ideal temperature should be 16 to 18 degrees. My house is 24 degrees. My house is not 18 degrees. So you have to be very practical. If you know your home gets very warm, you would use one less layer on your baby. If your baby is 4 kilos and below, and you think, okay, my house is pretty chilly, put an extra layer on top. If your home gets to about 21 degrees, that's fine. But remember, no hats in the house. Only put a hat on your baby when they go outside, even after you shave your baby's head. I have a lot of people ask the same question. Even after you shaved your baby's head, do not use a hat in the house. Put it on from when they're outside, because it can cause your baby to overheat. Another thing I would like to say is you're going to be very sleep deprived. I've done night nanny work, and I've done some nanny work where I've looked after babies over a 24, 48-hour period, and I was exhausted. So there's a picture you can see where the lady is holding the baby on her chest and she's asleep. I would stress to you, when you're asleep, when you're at home at night, don't fall asleep with your baby on the chest, or if you're on a sofa watching TV and you're feeling drowsy, put your baby down, even if it's the floor, put your baby down, wash your face with some cold water, dry yourself and pick your baby back up and put them somewhere safe to sleep. Because if you're sleepy and you're holding your baby and walking around, you've got a higher chance of tripping or falling over. Yeah, so hopefully that makes a lot of sense, but there is a lot more information on the Lullaby Trust website. So have a look through it. It will talk to you about safe sleeping, and it would also talk to you about the essential things that you need to buy also. There's another few things that we'll need to buy, which are going to be on the next slide, which you will see. You need some sort of feed, how you're going to feed your baby. Everyone wants to breastfeed, and that's fine. I'm very pro breastfeeding, but I would always say to you, just have a little bit of formula at home just in case, and a bottle. So if you have bought a sterilizer, a lot of the sterilizers come with bottles like this, so that's fine for you to use. You don't need to buy a specific bottle, that's fine. If you have a sterilizer that doesn't provide bottles, I would say to you, just try and go out and get 1 or 2 bottles at home. You don't need to buy a whole set. These are good to use just in case you're finding difficulty with breastfeeding, then you've always got a bottle to hand. The MAM bottles, so it's MAM, they are self-sterilizing in the microwave, so they're great to use also. Also, I would say to you, get some formula. You don't need to buy a big tin of powder, as you can see in the picture. You can buy small bottles like this. These are great to use, and you can even get larger ones. You don't need to prepare it anyway. You can keep it in your fridge, but you must use within a 24-hour period once opened. You will need nappies for your baby. Any nappy is fine. Any brand is fine. It's perfectly fine to use anything. Wipes, I would always say to use water-based wipes, because they do not have any perfume on them, which can cause your baby some nappy rash. If you don't want to use wipes, you can use cotton balls and water. It's really important to get a car seat. If you are not going to go home by car, you can, and you're going to walk home from the hospital, or use a taxi that take pushchairs, you most probably won't need to use a car seat. But if you're thinking you're going to have to drive around to get to places, I would say do get yourself a car seat. You can use a used car seat. You do not have to buy a new one. If someone has a car seat they are giving to you, or you are borrowing from them, perfectly fine to use. Just remember, you must know the history of the car seat. Make sure it hasn't been in any accidents. When a car seat has been in an accident, the outside looks perfectly fine, but the inside is all broken. So I would say to you, just ask someone, just say, can I have the history of the car seat, and has it been in any accidents? There's rearward facing car seats, as the picture shows here. There is swivel car seats. There's the Isofix car seats. There's so many. I can't tell you. There are so many. If this period of time, if you're due in the next few weeks and you haven't been able to buy a car seat yet, I would just say to you, ask someone if you can borrow theirs if they're living next door to you. Or I would say to you, just order something online. The easiest one to order online is the rearward facing car seat that you can see in the picture here. The swivel car seat is great if you've got back problems, so you don't need to bend down too much, and so is the Isofix as well. When you are putting your baby in the car seat, I see this hundreds of times all day long. People have these big, big snowsuits on their babies. The babies are tiny and the snowsuit is so big. And what can happen is the straps of the car seat hold the snowsuit. They don't hold your baby. So the weather's really good at the moment, so you won't really need a snowsuit. If you're delivering wintertime, you might need one, but make sure it's something fitted. I would say to you is, if you do not have one, it's fine. Put a cardigan on your baby, or what you need to do is put your baby in the car seat, strap them in with their vest and their baby grow on, and then you can just take your blanket like this and fold it up and put it on top of your baby, not covering the head, just wrap them around like this. And just remember a hat, put the hat on your baby, and this will keep them warm. You have heaters in the car, so you can just use them. Another thing you will need to get, I would say to you, is try get a thermometer. Just with everything going on at the moment, it's a really good idea to have one. See if you can order them online. The ones I like are the underarm thermometers, or the ear thermometers are great to use. Just get whichever one you can. And if you have another child at home, it's even better because you may already have one. I always say when you're checking the temperature of your baby and you're using the thermometer, just remember, if your baby's crying and moving around a lot, that means you're checking the temperature well. It must go right under their underarm. And I always know at work, if the baby's crying, I'm checking the temperature really well. But yeah, that should be hopefully the essential things you need to buy. You may want to get a breast pump. If you're finding difficulty and you don't know which one to get, I would say to you, just get a cheap handheld breast pump for now. You can always hire breast pumps. Just look online. Your health visitor and your midwife will be able to advise you which breast pump to use. But hopefully that is all. Right. So next thing is your hospital bag. You are going to get these slides, so don't worry about writing everything down too quickly. But I would say to you for now, especially if you're due very soon, have that hospital bag ready, have it packed and keep it by the door. I would always say pack for 2 days. Don't take your kitchen sink. You don't need to take a big bath. You just take your essentials that you need. And if worst comes to worst and you need some more things, ask your partner to run out and get it for you. Even though they may not be allowed back into the hospital, they can give it to the security team downstairs and they will be able to run it up to postnatal ward for you. I did have someone want to order delivery the other day. I don't think ordering food will be possible, but just take a few snacks with you, some crisps, some juices that you might like that are carton juices, or some biscuits. Just have that with you just in case. But hopefully that will be okay and you will get the slide later on.
Thank you so much, Jamila. But also where you'll have some time to continue to submit questions. I'm sure that some of you will have more questions that have come through on what you've heard from Jamila. At this stage, if it could be through Menti or the chat, please. All the questions are being collated from now, and they will be answered during the end of our second dedicated question and answer.
Okay, I hope everyone's had a little breather. I did have to have a breather myself. So the next thing we're going to talk about is your baby. Your baby's arrived, yay! This is the most exciting time. And I want to stress to you, just like Dr. Gerard was saying earlier, anything can happen. Anything can happen. What I don't want you to think in your head is, I'm going to deliver at this time. The weather is going to be like this. This is going to this. This is going to be this. Just be open to anything. If for some reason you do have to have an emergency cesarean, one thing a lot of mothers have said to me afterwards is a number of people in the room. Even with COVID happening, you'll have the midwives, you'll have the have a different set of team with you. But remember, if your partner can't be with you, there will be a midwife there to hold your hand. You're not going to be totally alone. So don't panic and don't worry that and just say, okay, my partner's not with me, there will always be there someone there with you to talk to you. And what happens most of the time is once you've delivered, they'll show you your baby. They'll just give it a once over by the midwife. They'll just check everything's okay. And then they'll give your baby to do skin to skin. So as you can see the two photos, there's the lady at the bottom. She has literally just delivered. They've cleaned her baby up. They've done their checks and they've given her the baby to do some skin to skin. Most of the time, if they're transferring you from delivery suite to the postnatal ward, they don't normally put the baby in a cot. They put the baby on you to do skin to skin and transfer your bed upstairs through lift or through down the corridor while you're doing skin to skin. A lot of the time people ask me how many times I need to do skin to skin in a day. It's up to you. You decide how much you want to do. It's great before feeding, even sometimes great after feeding, but if you're sleepy, feeling very sleepy, I would say to you not to, just put your baby down. Another thing is if you are in hospital just for a short period of time, so you deliver in the morning and you're out by evening, it doesn't mean it just has to be you who does skin to skin. As you can see, my favorite actor over here, he's doing skin to skin as well. So it just doesn't have to be mum. It can be dad or your partner as well. What I've had a lot of questions, especially from men, is I have a hairy chest, how do I do skin to skin? So I would say to you, just get a little muslin. Mine's quite big at the moment. If you fold it like this on your chest, put your baby's head under the muslin, and then the rest of their body on your chest. You can do it this way. Always remember when you're doing skin to skin, put a blanket on top of baby and put a hat on as well. You can do it as many times as you want, even at home. It's a really great way of bonding. So it's totally up to you. As many times, I do encourage it a lot. Another thing I just want to say, when you are in hospital, they wait for your baby to pass urine before you go home. You'll hear from another mother later, it took her baby 11 hours after birth till he passed urine. So they were there for another night. So that's the one thing they look for. You might be absolutely fine, but they just need to wait for your baby to pass urine. Right, feeding. So when we do our sessions in Jamaica, these are really practical, which I do show a lot about breastfeeding and about bottle feeding and the different positions. I'm going to try and do as much as I can here. You will get these slides, but if you can see in the top right hand corner, you'll see the position the lady is using for breastfeeding. She's got 4 different positions. One thing I want you to remember, ladies, your partner will pressure you to breastfeed. 100%. I have seen it. They will tell you, come on, breastfeed this, breastfeed that. You do it when you're ready, and you do it the way you're comfortable doing. The midwife will tell you what position to use. If that doesn't work, you use your own position. Have a look at these photos and try the different positions out. There's cradling positions, there's a rugby position, or there's a position when you're lying down. One thing I would say with COVID, and especially if you're living alone at home, if it's just you and your partner, you don't have any other distractions from anyone else. So you don't have people kind of telling you what to do. You do what you find works best. So I'm going to go through the different positions with you. I have sorry, I did have something. Okay, so one thing let's go through is breastfeeding. I find this position, see how baby is like this? If you want to make the screen bigger with me on there, it might be easier. So what you do is, see how I'm going to scoop baby? I'm going to scoop baby up like this. My thumb and my second finger is going to be here, And this is the way I'm going to position baby. You don't want this, because this is going to prevent baby moving their head back and forth. This is a great position because you can decide when baby is the baby can decide when he's ready to come off the breast. You've got some sort of control holding him, but you still have, you can see, a little bit of control under his jaw as well. It's really helpful position. And put your baby this way. What you don't want to do is bend your shoulders over when you're feeding. Remember, bring baby to you. You don't need to bring baby to the breast to baby. Bring baby to you. Always sit back. Even if you're trying to initially get the breast to baby in the beginning, if you find it's easier to crouch over a little bit, once baby's latched, sit back and relax. The more you're relaxed, the more relaxed baby will be. Another thing I would say is I've seen a lot of times babies screaming and screaming. Mom's trying to get baby to latch, but they're really screaming. What I would always find is your little finger works a charm. So when you're in your position, give your baby your little finger to suck first, and then put them to your breast. They'll feel a lot more relaxed. So once you do start to try latching, your baby will automatically hopefully stop crying and latch onto your breast. Remember, once baby's mouth opens, put them to your breast, let them latch on, and then sit back. Your babies will cry. It's natural, but hopefully once they're latched on, you'll find it a lot more comfortable. Another thing I would say to you is, a lot of people say, is my baby taking enough? You'll know if your baby's passing urine, opening bowels. You want them to have at least 6 to 8 wet nappies a day, and you want them to open their bowels at least 3 to 4 times a day. If you're finding over a 12-hour period, your baby hasn't had a wet nappy, it could be that they're dehydrated, they're not taking enough milk. So contact your midwife if possible, or your GP. They will be able to help you with feeding. And if you are not having much luck and you don't know how much your baby is taking, you can express some milk into a bottle. It's perfectly fine. Or you can give them a little bit of formula. It's fine. A fed baby is a happy baby. A happy baby is a happy mother and a happy home. So it does not matter. Don't put pressure on yourself. Just make sure your baby's fed in any way possible. Another thing a lot of mums say when they say, how much has my baby taken? You want to feel your breasts before the feed and feel your breasts after the feed. That way you'll know. If your breasts feel quite full before the feed and they feel a lot softer after, then you'll say, okay, my baby's had quite a lot and I'm satisfied. Some people can't always feel, their breasts may never change, like softness wise, but it's up. You just have to go with the flow and just see how it happens. Another thing is, if your baby's feeding every hour, they're probably not latched on so well and they're not taking enough. You want your baby to feed over at least 10 to 15 minutes. You can switch between breasts if you want to, it's up to you, but you do want that. If your baby's feeding every hour, they're probably not having enough, or it could also be a sign of wind. So try burp your baby, or I would say to you, give something for your baby to suck on, so your finger or a dummy, and then give it a good 1.5 hours, 1.75 hours, then feed your baby again, and hopefully that will help settle your baby and get them to feed for a lot longer. We'll just go through bottle feeding quite quickly. So I always say with bottle feeding, just make sure you're preparing formula correctly. There are websites that we're going to give you to teach you how to make formula. You can get powdered or you can get liquid formula. I always find when you're switching from liquid to powder, babies do get a little bit constipated. It could be 1 or 2 days before they open their bowels, but don't worry, it's totally normal. We find it happens all the time in the hospital. So what you do, you get your bottle, you pour some milk in. Oh. And then you put your lid on top. Make sure your bottle's sterilised before. Always with bottle feeding, when you are going to bottle feed, make sure, if you can see here, oh, a bit wrong. Can you see? The teat is always full of milk. So you want this teat always to be full of milk. If you're feeding like this, there's not a lot of milk inside the teat. And what can happen is your baby can take in a lot of air. So make sure the bottle, the whole teat is covered in milk. Another thing I would say to you is when you're feeding baby, you don't need to feed them like this. This can make your baby very hot. And what can happen is their neck space would go a lot downwards like this, and that can prevent your baby swallowing. So make sure you have a good gap. See my hand is, have your baby sit up a little bit, and see my hand, I have control of my baby through one hand. So just put your fingers, you can put your thumb under the neck and put your fingers around like this. Make sure your baby's further away from you. There's a nice gap underneath here, and take your bottle, and what you can do is, like the breast, move it along their lips, and then once they open their mouth, put the bottle to their mouth. Another tip is, make sure you're holding the bottle lightly so it doesn't feel too heavy in their mouth. The heavier you're holding the bottle, the harder you're holding it, the heavier it's going to be in their mouth. So make sure it's very light. I always say, along with breastfeeding and along with bottle feeding, is have a muslin or a bib around the baby, so it just makes it easier for you. What you'll find with tissues is you'll use hundreds of tissues, so this makes it a lot easier. Another thing I would say to you is burp your baby. Everyone's going to say to you, breastfeeding, your babies don't get windy. They do get windy. So sit your baby up, let's see, sorry, and just put your hand under their neck. I always say it's kind of like a strangle position, but see my fingers like this, put them under their neck, not holding tightly, holding very gently. You have full control of your baby through one hand. And then you can sit them up and just rub their back, pat their back, or you can put them on your shoulder and pat their back like this. But we are sent you a few tips and a few videos for you to watch, so hopefully that will give you a better idea. Right now you may not be able to access lactation consultants, but there should be maybe some of them might be running online classes that you can access. Speak to your midwife and just say to them, what is my support in my community regarding to breastfeeding? Speak to your health visitor, speak to your pediatrician, and just do some of the research yourself as well. Google online and see who there is to support you in the community. As I said before, fed baby is a happy baby is a happy mother is a happy home. So hopefully that answers all your questions.
Thank you so much, Jamila. Wow, really impressive array of vital and practical information. Please do feel free to go back onto Menti. We've already started collating some questions for Jamila, which will be answered at the end of the workshop in our dedicated final Q&A. But this is also a good time to go into Menti or on the chat and submit any questions you may have. Thank you once again, Jamila. A lot of lovely questions coming through for you, so they'll all be answered in our dedicated Q&A at the end of the workshop. So moving on to the next bit of the agenda. Giving birth and the arrival of a new baby is definitely life-changing. But alongside the practical and the medical challenges that I think have been very, very well discussed today, there exist emotional and maternal mental health issues as well. So today we've invited Salim Jakra, as I said, consultant child and adolescent psychiatrist, to help us understand some triggers and tips within this area. Welcome, Salim.
Thank you, Sheila. Yalimadis, everyone. So I'm going to spend a few minutes talking about maternal mental health in the context of the current coronavirus situation. It goes without saying that having a baby is a huge life event. It's natural to experience a vast range of emotions, worries, mood changes, highs and lows during and after pregnancy, and this is entirely normal. But if this starts to have a big impact on how you're living your life, how you're able to function, then it's possible that you might be experiencing a mental health problem that needs help. And the information that we have suggests that about 1 in 5 women experience a mental health problem during pregnancy or in the first year after birth. It can be really difficult to feel able to talk openly about how you're feeling when you become a new parent. New mums have talked about the pressures that they can feel during this time, and often this can include the pressure to feel or to appear as if everything's perfect. So to look happy and excited all of the time, to look like you're on top of everything when you might feel like you're not. It's entirely natural to feel emotional and overwhelmed after experiencing childbirth and becoming a parent, especially as you're likely to be coping with a lot of new demands on your time and attention, and probably not getting very much sleep as well. So the key message is that it's important to ask for help or support if you need it. And you're likely to find that many new mothers are also feeling the same way as you. Next slide. As with most mental health problems, perinatal mental illness is also multifactorial. And if you look at this list, you can see that the coronavirus situation ticks some of these boxes and exacerbates them. It is a challenge for people to currently physically move around and offer practical support that they might do otherwise. Some living environments can feel like a bit of a pressure cooker at the moment, and this situation is of course inherently stressful. So all of those are additional triggers or causes or risk factors. So thinking about coronavirus specifically, the information that we have suggests that the current situation increases the risk of anxiety and depression in new mothers. But I'd also mention that that's probably the case for the general population as well. This makes sense because there is a lot that we can worry about or feel sad about at the moment. These are really difficult times for us individually, as a community, and globally as a species. So the situation could potentially occupy a lot of our thoughts, and therefore the importance of taking care of our mental well-being is crucial. Finding ways to look after yourself that fit in with your lifestyle and your needs can make a big difference to your mental health. So the list that you can see is relevant for all new moms, but is even more important in the current climate. So with regards to the support network, I would highlight the importance of planning in advance where you hope to be in terms of being able to access the help that you need, who's going to be there with you, both virtually and physically. In terms of looking after yourself and self-care, these things can look pretty obvious. So trying to get some exercise, getting enough sleep, taking time to relax. And they are obvious, but they are important. So just as you would be taking care of your baby, you do also need to take care of yourself. If it does feel like things are getting worse, then the usual reports, of course, still apply. So your GP, the antenatal care, in terms of your midwife, the obstetrician, and specialist mental health services if needed. In addition, there are a huge number of support groups and charities that can be helpful, and I hope that a list of these can be made available to you after this session. I'm not going to go into detail about treatment, but if this is needed, then a combination of talking therapies and or medication are available depending on your specific situation and your needs. So finally, in terms of how other people can help, I would suggest being there for the new mum, letting her know that you're there, keeping in touch virtually if you can't physically be present. In terms of your interactions, be guided by the new mum's needs. Give her space if she needs it. Listen, try not to make her feel judged. Practically, you can help with laundry, cooking, babysitting, and shopping for all of the things that Jamila mentioned. And lastly, if external support is needed, then you can offer to arrange an appointment or even accompany them if that's what they want. Thank you.
Thank you very much, Salim. Some very important information for us to digest today. Another very important angle for consideration when preparing for parenthood, or certainly having newborns in the house. Now, before wrapping up and going straight into our Q&A, there are some lovely questions coming through. We have to acknowledge that all this becomes reality very, very quickly. So Abida Hirji, a second-time mother of a 1-week-old newborn baby, has been kind enough to share a little of her personal information and experience with us for you today. Baby Kyan is going to be introduced to us, I think, on screen, and Jamila will share some of Abida's words to you today.
Hi, so I'm just going to read off what Abida has sent to me. Hopefully you can all hear me. She had her second baby last week, Sunday, and unfortunately we don't have a photo at this time of baby, but I'll just read this off. So, being an expectant mum or having to give birth during this current coronavirus situation can be causing some anxiety amongst people. I gave birth last Sunday to my second child at Northwick Park Hospital. It was a natural birth in the birth centre. Prior to giving birth, being heavily pregnant during this time, my family and friends were all extremely worried about myself and the baby. I didn't really worry very much, probably because it was my second child and I knew what to expect in terms of being a mum. Being in hospital felt very safe. They are taking measures with necessary PPE, treating suspected COVID pregnant women in isolation rooms, and trying to get people in and out as fast as possible, still providing the best care. Having your first or any child will be the most memorable experience of your life. And whilst you are going through labour, the only thing you will be focused on is yourself and the child. You will forget everything going on around you in the world, and once your baby is born, all the overwhelming and amazing feelings you will instantly take over. It is much easier said than done, but just continue to focus on yourself and your baby during these challenging times. And try and not to worry, because soon you will be back home with your baby. You will also have certain ideas of the way you would like things to go, the birth, feeding, routine, etc. Make sure you don't put too much pressure on yourselves. Things will change and circumstances may arise that don't allow things to go the way you planned. This happens all the time. If you plan to breastfeed and you are unable to, or are finding it too much, it's okay. As long as your baby is fed and healthy, that is the most important thing. Being a happy mum gives to a happy baby. Being a new mum is an extremely overwhelming experience. You will have no idea at times why your baby won't stop crying. You will be sleep deprived. You will have emotions all over the place. But just remember, these things go so fast, and just enjoy every moment. Every mother is in the same boat, and all these feelings are totally normal. Babies grow so fast and go through so many different phases, so just keep this in mind. Another cause for anxiety at the moment is having some routine antenatal appointments cancelled, especially for first-time mothers. If you have any questions or are unsure about anything, you can always contact your midwife. We have such an incredible platform here in our community with many women in the same situation and lots of women who have been through this. So please reach out to any of us if you have any questions or anxieties, as it will help to put your mind at ease. I hope that gave you a better insight.
I think that was an incredibly personal perspective, a very timely one, considering she's obviously just given birth in light of the current coronavirus environment. I think a lot has been shared on some very practical, invaluable and reassuring advice and information by all our speakers today. I think all our participants will agree on that. Now, we do wish to reiterate to you that, as I think all our speakers have done, and the same in the words of Abida and Solomon and so forth, that we are here for you. There are brand new initiatives. As you can see on the screen, you'll see various areas where you can reach out to. There are brand new initiatives alongside all our institutional partners, including one-to-one support groups Embrace and the WAP Sisterhood Forum, which is a virtual and confidential meeting group for women. And the launch meeting for this will be held on the 19th of April. The first topic we'll be tackling is loneliness. You'll also be fully aware of the Coronavirus Support Team Helpline. The maternal mental health awareness event is planned for the 3rd of May. So please look out for any more details on that through Al-Saha. And there was a quick mention about Bea and faith formations here. So we've got WAP's Preparing for Parenthood workshop part 2, which will take us a step further after birth and once the baby is home. And that will include information and guidance on faith formations, education and play and finances. Now, just to give you a little bit more information on the Bea question, at the moment, as it stands at the moment, obviously this may be updated as things move. Muki Kamriaz will give blessings over the phone, but actual Bea will take place once the Jamaat Khanas are open and social distancing measures are lifted. So just to answer that one question there. Now, you may have already seen some marketing for these various initiatives that you see on screen, but once again, we will be circulating a complete resource pack for all the participants that will include full details about all these various support areas that are available to you. We just thought it would be very kind to us all just to take a minute, just to calm our senses and just to reflect in silence, just for a minute, before we go into our Q&A. Thank you all for taking just that minute, just to reflect in silence and process everything that we have heard, shared, and discussed today. Right, we're on that stage now where we're going to launch into our questions and answers. There's quite a few coming in here. I see Dr. Jivraj is back on screen, so if there are any other questions for our eminent consultants, please do put them through the chat, through Menti, or raise your hand. But just before we do that, can we urge you to please log into Menti now and complete the evaluation that we have posted. This evaluation is truly invaluable, not only for you, but for us, so that we can continue to improve our offering and ensure that participants are receiving the information and the support that they need. Just a reminder, please can we urge you to log on to menti.com now, type in the number as it is on screen. Most of you have been on it already. Please do complete this evaluation that we have posted. It's invaluable for you and for us so that we can continually improve our offering and ensure that participants are receiving the information and the support they need. Thank you, everybody. Just another minute or two, please, 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 can we urge you to complete the evaluation on Menti. It is a slight extension to the evaluation that we did right at the beginning, pre-workshop. And it would be really helpful if we had your support in completing that and the questions. In the next 30 seconds or so, we'll launch into our Q&A. We're right on time, so hopefully we should be finishing on time. We've allocated about 15 minutes. So without further ado, thank you again for completing the evaluation. It's on Menti. Please feel free to go back and complete it before the end of the session. So without further ado, we will launch into some of the questions that have come in since Jamila's session. Jamila, a question for you. What size nappies to take to the hospital and how many?
Pardon?
What size nappies to take to the hospital and how many?
Okay, so it would be size 0 and just take 1 packet with you. If you run out, they should give you some there, but you will need size 0, so they are newborn nappies. If you know your birth, through your scans, you kind of know the weight of your baby, and if you think you're going to have a very big baby, I have seen some, take size 1 nappies, but normally you do need size 0 to size 1.
Thank you. Next question. Do you need to take formula to the hospital? And if so, how much?
Yes, I would say take formula with you to the hospital. 90% of hospitals will not give you any formula because they are trying to use breastfeeding initiatives. So I would say to you, take some formula with you. As you can see, the bottle I have here, you do get smaller versions which are in packs. And the smaller version in the pack comes with a teat that you can put on top. You normally get about 6 bottles in each pack. So your baby would normally feed maybe 5 to 6 times in the 24-hour period out in the beginning. And what you can do is keep those bottles as well with you. You can ask if they can put them in the fridge. So I would say to you, just take 1 pack. In 1 pack, you do get 6 bottles. So 6 bottles should be enough.
Fantastic. Continuing with you, Jamila, just as they've come in. Thoughts on new infrared thermometers compared to ear thermometers?
Okay, so I have used the infrared thermometer, but sometimes I find they can give you not so great readings, but they are fine to use. And the ear thermometers, they're great to use as well. I do prefer the ear ones because you find your reading is a lot more accurate. But if you really want to get the infrared one or someone has given you one to use, go ahead and use it. It's perfectly fine.
Okay, great. We have somebody that's raised their hand. Shamsha, you've raised your hand. Would you like to come in and ask your question? And if you could direct it who it's to, that would be very helpful.
Hi, Yalimudad. Shamsha is 23 weeks pregnant, and I don't know who to direct this to, but so we had plans for mother-in-law to visit from India this month. But considering the situation, obviously we've postponed it. But say in a month's time, if the lockdown lifts and if the flights are resumed as well in a month's time, we're thinking how much of a risk that is, of inviting her over here to UK from India. So that's the question.
Dr. Jivraj, perhaps this is one for you.
Yeah, Yalimadad, to be honest, at the moment, how long's a piece of string? And we really cannot tell. Things are changing every day. Let me give you an example. 2 weeks ago, the first version of the RCOG guidelines came out. We're already on version 7. Every other day, they're being updated. So I'm afraid I cannot give you a specific answer, let alone give you the risks of actually inviting your mother-in-law here. I would say just keep a watch out for what government advice is and take it from there. But at the moment, I don't think anybody will be able to project for you.
Yeah.
Thank you very much, Dr. Jivraj. Next question that has come through, Jamila, I think this one is back to you. Should you give your baby water? And if so, is it at room temperature tap water okay? Or should it be boiled first or bottled water?
Okay, no baby needs water. Your baby just needs milk. I've heard midwives say to mothers, let your baby have water because they're thirsty. Babies are hungry, so they do need milk. When your baby is 6 months old and starting the weaning period, then you can give your baby water. And the water we would advise you to use is fresh boiled water. So fresh water that's been in your kettle, just boil it and let it reach 100 degrees and let it cool down. So hopefully that answers your question. Your baby does not need water.
Okay, thank you. Question here, do any presenters have any view on getting breast milk from a breast bank?
Yeah, the thing with breast banks, in the UK, there's nothing verified for people to buy breast milk from a breast bank, because the breast banks that we use here are just for premature babies. And even in the moment in the UK, we don't even have enough milk. So I personally would not advise it, because you don't know if the mother's definitely had all the blood tests, if the milk has been pasteurized as yet, because all of the breast milk has to be pasteurized, and you just don't know exactly where it's come from. So there is that risk. Any formula is perfectly fine to use. It's not going to harm your baby. And just remember that even if you can give your baby a little bit of colostrum in the first couple of days and you're unable to breastfeed after, it's fine. I would say to you turn to formula. That's the best way to go to. So definitely not to use a milk bank.
Thank you for that. And just continuing on the feeding side of things, there's a question. For clarification, should the baby be feeding every hour? And when you are feeding, alternate between each breast every 15 minutes?
So no, your baby shouldn't be feeding every hour. If your baby's feeding every hour, then you have to say to yourself, okay, why is my baby's probably not getting enough milk. Some babies do cluster feed. So if they cluster feed in the evening time for a couple of hours, that's normal. But through the day, if your baby's feeding every hour, they're not getting enough milk. So for a baby to stay healthy, they need to be fed, they need to sleep. And if they're feeding every hour, they're just going to burn calories. What was the other part of the question?
And when you are feeding, alternate between each breast every 15 minutes?
You can do. The guidelines have changed so much. When I did start my job about 6 years ago, the guideline was change between 15 minutes one breast, 15 minutes another breast. Then 3 years later, it changed from just feed on one breast. Then it changed from if you don't feed on the other breast, you can alternate. Do whatever works for you. Don't worry about timing, just do whatever works for you. If you find your baby prefers one breast than the other, feed them on that breast, try the other. If not, you can express some milk out from there.
Thank you. Right, on to another question. Generally, I'm eating healthily during my pregnancy. However, does it harm my baby if I eat a cheat meal once in a while? Dr. Shenaz? Jamila?
That is the most difficult question I've been asked today. What is in your cheat meal?
I'm not certain who actually asked that question, so I can only assume a cheat meal might include some junk food or...
I think we're all allowed a little bit of junk food every now and again. Keep yourself sane, it's fine.
And what exercises are safe to do during pregnancy?
Anything that does not make you too uncomfortable, too strenuous, do what your body will allow you to do. But let me just reiterate, you must exercise. And especially so now that we're actually under lockdown and we're all become a little bit more sedentary. I'm not entirely sure that is the case. I suspect everyone will come out of here a little bit more healthy now that everyone's itching to go out to do that hour of exercise. But there is one thing medically that I wish to add, and that has come to light recently. Pregnancy itself is a hypercoagulable state. And what that means is everyone's blood becomes a little bit more sticky and thicker in pregnancy. And that's the reason pregnancy itself is a risk factor for thrombosis. You're more likely to get a thrombosis when you're pregnant than when you're not pregnant. Coronavirus infection increases that risk also. as does immobility at home. So it's important, number one, if you're at home and you're well and you're not self-isolating, you're at home because you're following government guidance, it's important to actually continue to exercise. The second thing is if you're at home and you have to self-isolate because you are ill with suspected coronavirus, then you won't be able to go out to do your hours worth of exercise. Make sure that indoors as well, you remain mobile and you remain well hydrated. And if you do these two things, then hopefully you won't get the thrombosis and you'll be fine. However, everyone at their booking visit gets a risk stratification done to assess the risk of thrombosis. And points are given for each risk factor for thrombosis. So if you're aware that you are at risk of thrombosis, but have not quite scored enough to be given blood thinning injections, remember that if you have to self-isolate, you might now fall into the category of requiring those blood thinning injections. So if you've been risk assessed and you fall and you've got scores enough to warrant blood thinning injections, then you will have been given those. But if you haven't and have scored enough to warrant these injections, if there are any more risk factors that develop as pregnancy progresses, then do please speak with your community midwife or the hospital, because they may be able to arrange to have these injections delivered to you.
Okay, we have just had one final question come in, which I think if everybody is happy, we are hitting 5:45. Just again on the diet issue, Dr. Jivraj, very quickly, and then we'll have to unfortunately wrap this up. Is having an unhealthy diet in the first trimester dangerous to the baby? I could only stomach cheese on toast.
I don't think there's any evidence to suggest that having cheese on toast actually increases your risk of damage to the baby or increases your risk of miscarriage. So that's fine. If you can stomach cheese on toast, stomach cheese on toast. As soon as you can, get back onto having a balanced diet.
Fantastic. Thank you so much. Right, a couple of things have come in on the chat suggesting or asking, will you be going over techniques during the birthing process, such as breathing techniques? And is it possible to do a little more on breastfeeding at the next session in absence of antenatal classes? Thank you very much. We will certainly take on board any suggestions that you've given to us either through the chat, or please give them to us through our evaluation that we've posted on Menti. This is how we can provide to you the information that you really want to receive from us and any support that we can offer you. Thank you so much.